hello beautiful people. We are back again on our channel, and today we want to discuss about something related to OSCE, which is administration of inhaled medication. If you are seeing my face for the first time on this channel, I say thank you for coming to my channel to watch my videos. And if you are part of my returning subscribers, I say thank you for coming back to watch my videos. I say thank you, I love you, thank you so much, and I love you. So as I said earlier, I want to discuss about administration of inhaled medication. In this procedure is for 12 minutes, and you're expected to administer an inhaled medication to a patient. It might be salbutamol, just an inhaled medication. So most times it's always salbutamol, and it's given in the case scenario of a patient having ineffective breathing pattern or asthma, anything related to their breathing pattern. It might be pneumonia. So in case maybe you were given a case scenario related to asthma or breathing pattern in your assessment and planning, just be rest assured that you can't, but 90% sure that you might do inhalation of inhaled medication, administration of inhaled medication, or you do peak flu. So it's either peak flu or administration of inhaled medication. But today I'm not talking about the peak flu, I'm only talking about the administration of inhaled medication. It's actually for 12 minutes. So firstly, you will need to go and meet your patient, and before you meet your patient, you know the necessary things to do. You check your area for safety, you provide privacy, then you put on your PPE, then you move close to you wash your hands according to the WHO guideline, palm to palm, palm over the sun, vice versa, fingers interlace, fingers interlock, vice versa, touching opening of the tongue, vice versa, tip to the palm, the wrist, then you put under your running water, then you dab with a dry towel, then you discard into the black waste bin, not the yellow one, please. I'm saying it, not the yellow one. Then when you are done washing your hand, you move close to your patient, then you introduce yourself to the patient. Okay, I'm not so from today, I'm here to administer your inhaled medication. Then by doing that, you now ask the patient for their full name, their date of birth, then you confirm with their wristband. You also check for maybe they have any allergy. You also cross-check with their allergy band. So you just do the necessary things with the patient. Then after introducing yourself and telling the patient what you want to do for them, then you tell them again that you are there to administer their medication. So when you are done with all the full process of you going to meet the patient, then you remove your gloves, you remove your apron, you come and check your prescription. Under that prescription, that's when you verify. You just do it like a drug. It's actually a drug anyway, so you do it like the drug medication administration process. So you have to verify your prescription too. You check maybe the prescriber's name and signature is present or BIP number is present. Just read out all the necessary things, the route of administration, the name of the drug, maybe it's 2 puffs of 3, but most times it's 2 puffs. Then when you are done validating your prescription, you verbalize it that your prescription is legible and is valid, and you are happy to go ahead. So when you are done validating your prescription, then you move to you validating your equipment. Then you check maybe the spacer device rather. So you check maybe it is still in good working condition. You can even verbalize that examiner can confirm that this spacer device is in good working condition in less than 1 year. Then the examiner will answer you yes or no. Then if there is expiry date, you just say it out. Then you check your drug, maybe still valid, then check the expiry date, you verbalize it as well. Just ensure your equipment are complete. It will be there anyway, so you just say it out and let them know you know what you are doing. So when you are sure that your necessary equipment are complete, then you move back to the patient. So you wear your PPE, your gloves and apron most times. So when you move close to the patient, you will now do your second ID check. In the beginning, you've done that before you go for your prescription check. Then you now go and do your second ID check because it's a medication, so you still have to do it. So you just go back to the patient and ask for their full name, their date of birth again, then what their allergies are, and also cross-check with their wristband, and as well cross-check with the book you are holding. So the three must be correct. Then when you are done doing the ID check, you can now tell the patient what you are meant to do. Check if the patient is comfortable, if there's any pain or not, the location, the type of pain, is it sharp, is it throbbing, is it deep, all those things. You just need to verbalize it and ask the patient. Then if you can ask the patient, do you know how to use inhaler? If the patient says no, then you demonstrate to the patient on how to use it. So firstly, you have to remove the inhaler from the covering, then shake it for like 2 to 5 seconds. So when you're done shaking it for like 2 to 5 seconds, then you insert it in a, let me say, love shape. So you put the inhaler into the spacer device. So there's a mouth covering, like just an opening that the patient will put into his or her mouth. You won't put it at that opening, but the other one. So you now tell the patient to hold it, tell the patient to tilt their head backward. Then you ask if the patient can hold their breath for like 5 seconds. So there are two ways to go about it. If the patient can hold their breath for 5 seconds, then that means, if the patient can hold their breath for 10 seconds, like 10 seconds, then you will use the single breath method. But the other one is several breath or tidal breathing. So the one of the single breath method is you ask the patient, maybe they can hold their breath for 10 seconds. Then if they can hold their breath for 10 seconds, then you have them to take a deep breath. Then you will now tell them to put their mouth around the opening of the spacer device. Then you tell them to wrap their mouth and their tongue around it so that any of the medication will not pass through the opening in their mouth. Then tell them to take a deep breath in slowly for like 2 to 3 seconds, then and hold their breath for 10 seconds approximately. So within that short period of time, you depress the canister. The canister is the thing in the, what's it called, where the drug is. So you depress the canister, then one puff, the patient has inhaled it. So if the patient cannot hold their breath for 10 seconds, that means they will do the one of several breath or tidal breathing. The one of several breath is the patient can hold their breath. So you see, they just have to inhale, exhale, inhale, exhale. So whenever they inhale, you just have to depress it so that they will inhale all of the medication. So when you are done giving the medication to the patient, it's just for you to, okay, you verbalize it, even though it might just be one medication you have to give. Sometimes maybe you want to give steroid with it, or you have any other inhalational drug you want to give. You need to tell the patient to wait for like 30 to 60 seconds between inhalations. It's the same medication like salbutamol. So when you press one puff, then you tell the patient to wait for like 30 to 60 seconds before you depress the canister again to give them another puff. But if it is totally another medication, so you need to wait for like 2 to 5 minutes. This one is not seconds, so you need to tell them to wait for like 2 to 5 minutes for them to be able to absorb the drug. So the first one would have been done, then you now have to give another drug which is different. So imagine you are giving to inhalational drug, even though it might not be possible, but in case, so you have to wait for like 2 to 5 minutes before you give the other drug. You should always know that you need to administer bronchodilator before steroids. That bronchodilator would have helped to open the airway so that the steroids can work properly and you'll be able to see the effect very, very well. So when you are done administering the inhalational drug, you just need to take the spacer from the patient. If eventually you are maybe administering a drug in a community, that means you tell the patient, okay, this is a spacer, so you are expected to wash it with a mild soap and water, then just air dry it. Not that they'll put it under the sun, just tell them to wash it minimally with soap and water. And if you are the nurse, maybe the patient is in the hospital, and if you tell the patient, can they do it by themselves, and they said no, so you're expected to just verbalize that, okay, well, bring it back after washing it with a mild soap and water, and that's all. Just make the patient comfortable. It's 12 minutes. I am sure you'll be able to finish it. If it's just for you to go to the patient, remember to do your 2 identity check. Then when you are done, depress the canister, shake the drug before you administer, check your prescription very well, and that's all. Ensure the patient is fine. Remove your gloves, remove your apron and the card into the yellow bin. Then document it that you've administered this because you're still going to sign. It's like a medication, so don't forget your documentation is also crucial in when you are doing any of your OSCE station. So you need to document, and believe me, you are going to pass that station. It's just easy. So the necessary things you need to do, remember, patients can take their breath for 10 seconds or not, all those things, remember to apply it, then it's a success. So thank you for watching this video. If you want to see more of these videos, ensure you view my videos that I've made from the past, even though it might be what you wanted or not, but please watch it, subscribe, follow me up for more videos, and I promise I'll be dropping videos every week by God's grace, because sometimes work is not helping, but I promise. Thank you, love you, bye bye, and happy Sunday.